in terms of making mistakes for people treating those with bipolar, the most common is not diagnosing it in the first place. Just thinking this is just depression, I'll treat it with an antidepressant like we do with all depressions, and then finding either the person goes into a manic or hypomanic episode, or more commonly, you destabilize their mood condition so their highs and lows become more frequent and more difficult to treat. That's number one. Number two is not educating the patient about their condition. It's not important that the doctor do it himself or herself. It's just important that it be done. It can be recommendation of books or websites or informational pamphlets, or going to the Depression Bipolar Support Group or the NAMI group, or someplace where the person gets educated. So it's important that the person understand their condition. It's important that the patient understand why they're taking the medicines and how to take the medicines correctly. That this is not just until somebody feels better. Feeling better may be a hypomanic or manic episode. It is important in bipolar disorder, at least in the stage of knowledge we have now, that people understand they need treatment for the rest of their life. They also probably also would be benefited by lifestyle changes in dietary intake and exercise and sleep patterns and the like. So I think finally, it is important for patients suffering from bipolar disorder that the doctor have an observant informant. It could be a family member or a friend or some other support person that can help the physician recognize when the patient needs help, because a patient may feel too good, may feel they don't need help. So you need an informant if you're a physician. And the other thing is, patients need to be followed regularly, both because they may be on medicines that cause side effects, sometimes serious, and also because you don't want the episodes to get too far out of hand before the patient gets treatment.